So people should wear a mask whenever they're in public, whenever they're going to be around people who are not in their household. And the governor has recently made it so that everybody has to wear masks in any place of business around the state. So basically, if you're going to be within 6 feet of anyone who is not in your household, you should be wearing a mask. Basically, you want the mask to cover your nose and your mouth. The most important aspect is that it cover your mouth, because that's really how it's working. So it's blocking the droplets that are exhaled in your breath when you exhale or when you cough or when you sneeze, and that's the main way that it works. So it is best not to touch the front of the mask if you can help it, although most people find themselves adjusting it occasionally. That's okay, but try to minimize it as long as, it's hard to be aware of touching your face, but try to minimize that. The way for all of us to be thinking about masking is that it works if everyone does it. When you see other countries that have managed to get their COVID infection rates under control, it is by way of masking, washing hands, and social distancing. There is no cure for COVID. There is no vaccine for COVID. So this is what we have in way of preventing the spread of it. The CDC has said that children under 2 should not wear masks. Anyone with respiratory problems doesn't have to wear a mask. A person who is unconscious or who is unable to adjust the mask on themselves should not wear a mask. But basically everybody else should be wearing masks in public. Cloth masks don't fit to your face. They have an area that's open on the sides. It doesn't really protect the person who is wearing it from everybody else around them, but it keeps the droplets from their mouth from infecting those around them. It works if everyone does it, and it really only works if everyone does it. If some people are not doing it, then those other people, even if they are wearing masks around them, are not protected as well. And that's where this kind of nuance comes in about how useful it is to wear a mask. It is very useful to wear a mask. In healthcare, we have been using masks to prevent droplet-borne illnesses from spreading my whole lifetime and well before I was alive. So, this was definitely something that was being done in healthcare long before now. It works.